The following program is in no way intended to replace your doctor's advice or treatment program, nor should it be used as a tool for the purpose of self-diagnosis.
Good evening and welcome to Valentine's edition of Your Health, Your Choice. And this evening we're going to be looking at diabetes and its connection with macrovascular disease. We have with us in-house once again Dr. Claude Khan, community diabetologist, and he's going to be sharing lots of interesting information, helpful information. This program is all about educating the community on health issues. So first of all, Dr. Khan, if you'd...
Well, it's good to be back live. So tonight, the Wednesday night programs are live, and then we have the repeat programs. And there are two telephone numbers.
Yes.
You want to tell us about?
Okay, so we are running live tonight on Wednesday, the 6th of February. So within the next half an hour, we will be taking live phone-ins. And you can call 652-4855. You can, while the program in the first half, you can call in WhatsApp us with any of your questions, and Dr. Khan will be very, very happy to answer any questions you have regarding diabetes and macrovascular disease.
And the number is up there, 360-0105. So in the second half of the program, we'll take live call-in programs, yes. But I have my iPad, so if you want to WhatsApp any of your questions, you can do that.
Yes. Okay, so first of all, we want to define macrovascular disease. Yeah?
So, diabetes, we come back to the whole concept of a multidisciplinary approach to diabetes care. Over the last few years, maybe 15 to 20 years, diabetes has moved on from being what we used to think of as a purely a sugar disease to really concerns about coronary artery disease. So I want to show slide 3. We're going to bring up slide 3, and slide 3 shows what we mean by macrovascular disease. We have coronary heart disease. So this is about diabetes, not just diabetes in the heart, coronary heart disease, cerebral vascular disease, and peripheral vascular disease. So three big terms.
Yeah. So we're talking about three major areas that are affected.
Yes.
The heart,
the brain, and the large
nerve endings.
The large blood vessels to the feet. Right. So the two major types of complications in diabetes are macrovascular complications, which we're talking about tonight, we're revisiting, and microvascular complications, and that's where nerve endings are affected. But when we talk about macrovascular complications, it's almost surpassed some of the concerns. We're still very concerned about microvascular complications, and we'll probably do that in another program. But we're talking about coronary artery disease, so preventing heart attacks, heart failure. We're talking about cerebrovascular disease, so preventing strokes. And, just yesterday, I had a patient in her early 60s, and very, a patient who's been well. Her blood sugars were not ideal over the years, and she was driving, taking her grandson to school, got back home, and on her way home, had an accident, crashed into a vehicle. And she seemed to have been confused, and although she remembers the event, what subsequently was shown is that she was disoriented, and when she was admitted to hospital, an MRI scan was done. It did show that she had an acute stroke. Fortunately, it was a small one, and she's not lost use of her limbs, or and her speech is still intact, etc. So we are trying to prevent those events, because once you have had one event, it's a sign or a risk of future events. And of course, peripheral vascular disease is where we have some of the major problems also, blockage of blood vessels to the feet and to the legs.
I think one of the signs of hope we want to give viewers this evening is that diabetes and all of these complications are preventable and manageable.
Yes.
Yes?
Yeah, absolutely, absolutely. And, you know, we are pursuing this whole concept of a diabetic wellness center, although we have been doing diabetes and we network with various people. We are now well into the process of in Vistabella, in Chagonas, talking about a diabetic wellness center, and we are thinking about you know, lots of patients who look at this program ringing from Port of Spain, and they've been asking about that. So I'll be giving you some more information about that later on.
Okay.
But I think you wanted to look at a clip?
Yeah, there's a 2-minute clip that very, in a flash, takes us through microvascular and then macrovascular diseases. So if Josh could bring that up, we can get a snapshot of the program's theme.
Yes.
Right, so that was quite creatively and vividly illustrated, but it went so quickly, and I know that we're going to spend the rest of the program trying to break it down into manageable portions.
So it covered both macrovascular and microvascular. So what we're going to focus on tonight is the macrovascular disease, and a major cause of mortality and morbidity. In fact, it went so quickly, but over 50% of patients with diabetes have a macrovascular event. Now, when I say an event, that could be a heart attack or a stroke. It could be a TIA, which is a transient ischemic attack, or some people call it a mini stroke. Or you may have blockage of blood vessels to the feet. That, together with neuropathy, can lead to amputations, etc. So over 50% of patients will have some sort of macrovascular event. And the underlying problem is atherosclerosis. So that's a big term.
Yeah, so let's break that down a bit. Atherosclerosis.
Right. So I wanted to bring up slide 5, which gives you a definition of what atherosclerosis is all about. So there's a lot of still controversy over this for some reason, and I don't know why, but this whole term atherosclerosis is a real problem. It's deposits of fatty substances, cholesterol, cellular waste products, and calcium buildup in the wall of an artery. It may grow large enough to reduce the blood flow, and very importantly, the third point there, an acute event occurs when the plaque ruptures, resulting in blood clots or fragments that can block the blood supply to the heart, brain, or lungs. So I just want to come off that for a minute and explain.
So we're talking about 3 major organs there.
Right. Yes. That's affected by this whole macrovascular disease.
Yes.
And again, we just want to remind you we are live, so in the second half of the program, people can ring, but right now you can WhatsApp if you have any questions on 360-0105, 360-0105. So now, people often ask me, Linda, about, and we're going to talk about statins, cholesterol tablets, and very often, you know, we've done the lipid profile, and we found that patients' cholesterol levels are slightly high, and there's a lot of myth, a lot of misunderstanding about cholesterol tablets. And people statins, you know, from the time we use the word statins, there's a big kind of thing about side effects and reactions, because, you know, we have been sold this myth that cholesterol tablets and prescription drugs have all these side effects, and herbal products like, well, I wouldn't call names, but have no side effects. But of course we know that what we always have to do in life on a whole is weigh up the advantages and disadvantages of any intervention. So, you know, even like exercising, you know, nobody will say that exercise is bad for you, but of course we know that if you exercise badly, you can end up with lower back pain. Knee problems,
ankle problems,
pulled muscle. So, you know, even exercise. I mean, you know, one of our family members, I think he was exercising and he ruptured his Achilles tendon some years ago, and that was a major injury. So no intervention is actually risk-free. But one of the points I wanted to point out is that when we talk about cholesterol buildup, atherosclerosis, so it's fatty substances, it's waste material, it's calcium buildup. You're not just trying to prevent buildup of further plaque, because the process of plaque buildup starts as a child. In fact, you know, if a teenager dies and you do a post-mortem, and you'll already begin to see what we call fatty streaks in the walls of the artery. So this process of atherosclerosis starts from a child, from birth. But by the time you get to your 30s and 40s, you then, with especially diabetes, and we'll talk about risk factors, you have plaque buildup beginning to block the walls, narrowing the arteries, but you get an event like a stroke or a heart attack when that plaque ruptures. So this is what people miss. We talk about just blockage of the arteries, but actually statins or cholesterol tablets also stabilize the plaque to prevent small fragments of the plaque breaking off and blocking the small arteries, because you have the big arteries and then you have the smaller arteries leading to the brain, to the heart, etc.
Right.
So you know, I really want people to remember that when we talk about statins, it's not just preventing further plaque buildup, it's stabilizing the plaque. And another reason I also say that is that I see it all the time. We put patients on a cholesterol tablet, the cholesterol comes down, and then the patient stops the tablet. And they come back to us and say, well, doc, my cholesterol is okay. Why should I still take a statin?
Okay. So coronary artery disease risk factors.
Yes. So coronary heart disease, but this also applies to cerebral vascular disease, the risk factors that we want to talk about. And we're going to bring up slide 6. Slide 6. There are about 7 or 8 risk factors here. And again, this is very important to get a hold of. Age, the older you are, the greater the risk of coronary heart disease. Gender. Now, what do we mean by that? I'll explain gender. Family history, lipid abnormalities, hypertension, smoking, diabetes, and central obesity. So there are 7 or 8
yeah.
risk
So those are
factors.
8 known risk factors. Are there unknown?
Well, they're probably unknown risk factors, but these are the risk factors that we work with at the present time.
Okay.
And it is very, very important, and we're going to show a patient profile probably after our first break, because when a patient comes in and you look at that patient, you know, very often people will say that aspirin is bad for you, or a cholesterol tablet is bad for you. But what you need to do with that patient, each patient coming through, your door is do a risk analysis. It's like,
so you take those 8 factors into consideration.
you take those 8 factors into consideration. So, you know, I always say to someone, if you are 20 years old with a cholesterol of 250, I am not particularly worried about that. But if you're 55 years old with diabetes, hypertension, and you're overweight, you already have 4 risk factors for heart disease. And I think, you know, that is what we call the art of doing medicine, not just saying that one drug will suit everyone, or, you know, everyone needs to be taking a colon cleanser, or everyone needs to be on aspirin. It's looking at what the risk factors are. So we said age, gender. I just want to explain that. Females until the menopause have a protective effect because of estrogen levels on heart disease. However, if you have diabetes, even before the menopause, women lose that protective effect.
Right, so diabetes then exacerbates
coronary, and this is the problem that we often miss as healthcare professionals. We underestimate the risk of coronary artery disease in females.
Right.
It's well known. It's a worldwide phenomenon. A 38-year-old woman might come in, and because she's not yet menopausal, but she has diabetes, she has a high cholesterol, and we think that, you know, if it was a man sitting there, we would, our thinking of coronary artery disease would be much higher. But women lose that protective effect because of diabetes. So diabetes, yes, exacerbates, and after the menopause, of course, women catch up with men.
We're going to take our first break now, but don't forget that when we come back, you can call in live, 36010.
No, that's a WhatsApp number.
Yes. So you can WhatsApp us on 360-0105 with any questions, and in the next break you can start calling in 652-4855, 652-4855 with any questions you have for Dr. Khan. We return in a few minutes to Your Health, Your Choice.
Looking for a safe place for the whole family? Well, now you found it. We are ACTN The Voice, your family-friendly station. Whether it's current affairs, kids and classic TV, sport and community features, Christian and music programming, plus so much more, ACTN is the station for you. Join us each day for programming that puts morals, values, and family first. We are ACTN The Voice, your family-friendly station.
Hey TNT, what's up? This is yours truly Positive, all the way from the beautiful island of Tobago, and you're locked onto ACTN, The Voice. We serve a mighty God, mighty, 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 mighty. Oluwa is mighty, oh. Blessed love.
In my ill sickness in my body, we serve a mighty God, mighty, 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 mighty.
Every Sunday at 2 p.m. on ACTN The Voice, we'll be taking you on a journey down memory lane with our Sunday classics. Relive the moments. Bonanza at 2 p.m. Little House on the Prairie at 3 p.m. Gilligan's Island at 4 p.m. Family Matters at 4:30 p.m. Hogan's Heroes at 5 p.m. The Jeffersons at 5:30 p.m. This is Sunday Classics on ACTN The Voice.
Welcome back to Your Health, Your Choice. Before we go into the next bit of our program on macrovascular diseases and diabetes, I know you wanted to share something with us about an XOXO experience.
Right. So, as you know, at the Anaposa Center, we also have a holistic approach to life, and we have a major marriage conference coming up at the Anaposa's Chapel on Saturday the 16th of February. That's 2 days after Valentine's. And we have a short clip, so that's next week, Saturday. And if you're interested, you can call the numbers and the other number that we'll give. So we'll just go to that short clip right now.
Every husband has what his wife needs. And every wife has what her husband needs, but we can only get it if we serve each other. You have to sit down and you have to make a decision. I'm going to use my strength to serve, not to rule.
The depth of your honesty with each other will ultimately determine the depth of your intimacy. You can't have secrets and intimacy at the same time in a marriage.
Any problem that you're facing is really not a his and her problem, it's our problem. It doesn't matter what it is.
Husbands, show and prove your love.
So the numbers were up there, and I can't remember those numbers, but the other number to call, it's 482-4269, which is our regular number. So you still have time to register for that conference, and of course
it's an all-day experience.
It's an all-day experience.
It's and lunch is provided.
Lunch is provided. So it's on Saturday, the 16th of February. So 482-4269. If you're interested, you have about a week and a half if you're looking tonight, the 6th of February.
Yes. Good for Valentine's, renewals, and so on.
Yes.
Yes. Okay. So back to
macrovascular disease and diabetes. So we're focusing on macrovascular disease in diabetes. So we said that we showed the risk factors, and in fact, what I often do, you know, patients often say to me when we do a cholesterol level or whatever, you know, do I need to go on aspirin? Do I need to go on cholesterol? And you know, these smartphones that we have now, or cholesterol tablets. Yeah. What did I say?
You said go on cholesterol.
Cholesterol tablets. You know, we have ways now of being very scientific in decision making. And one of the things we can do, there's a cardiovascular risk calculator that you can download onto your phone from the American Heart Association and the American Diabetic Association. And
that's impressive. Yeah. So every patient can do that.
Well, the patient can do it for themselves.
Right.
I do it for my patients, and people who are very savvy where technology is concerned, I show them the site. But what I show them is that I'm not just looking at a cholesterol level. We're looking at their age, male or female, their ethnicity, the blood pressure, systolic, diastolic blood pressure. Then we look at the total cholesterol, the HDL, and whether they are a smoker or not, and whether they have diabetes or not, and whether they have hypertension or not. So there are 10 factors we put, and then we press calculate, and we come up with a risk factor for heart disease over the next 10 years.
Oh, that's amazing.
And what I try to show patients by that is that I'm not guessing whether they need to be on whatever medication we're talking about. This is actually a scientific way. It's called a cardiovascular, a CVD risk calculator. And you can Google it, CVD risk calculator. There are various risk calculators. The one I use is from the American Heart Association and the American Diabetic Association.
Right, so we can do risk calculations. I know that there's quite a startling statistic with regards to diabetes and heart disease.
Yes.
So it's like 2 to 4, a diabetic is 2 to 4 times more likely to have a heart attack, have a stroke, have lung complications than a person without diabetes.
So I want to sort of explain this very carefully. So I want to just bring up slide 8. Coronary heart disease in diabetes. It is more common and occurs earlier than people without diabetes. So that's the first thing about coronary heart disease. Women lose gender protection. That's what we were talking about.
Yes. Yeah.
And very importantly, the third point, myocardial infarction or heart attack may be painless, it might be silent.
Right.
And albuminuria increases the risk of vascular events. So I'll explain what I mean by albuminuria.
Albuminuria, yes. I'm thinking it has to do with albumin. But
in the urine, yes. Right. But let me just back up a little bit. So we are saying that people with diabetes are much more likely to have a heart event. Therefore, a lot of my work as a community diabetologist is aimed at trying to prevent people from having a heart attack or stroke.
It's quite a shock, actually. 2 to 4 times more likely.
More likely. Yeah. But very importantly, you don't often get the typical crushing chest pain. You know, people think when you get a heart attack, you're going to have the crushing chest pain or the typical textbook medical school description of pain going up to the jaw or pain going down the arms or pain going through to the back. Very often it's painless. Yeah. And the reason for that is it's associated with neuropathy. So if you have neuropathy, which is nerve end damage, you don't only lose pain sensation to the feet, you also lose pain sensation in other parts of your body. So you might have a heart attack evolving, and whereas someone without diabetes may have crushing chest pain, you might just be cold sweating or feeling nauseous. I don't want to panic people here.
Yeah, that's quite
okay.
Quite scary. When the other surprising statistic for me was that every 10 seconds somebody in the world is dying of diabetes complications, or and 2 people are actually developing diabetes.
Sorry, I got distracted because we have some questions on WhatsApp coming here. I have one question here. Good night. What medications could use for increased blood flow? So what medication can be used for increased blood flow? Thanks for that question. Well, aspirin can be used for increased blood flow. Plavix, which, for example, that patient who had a stroke, they were placed on aspirin, but normally if you have a stroke or heart attack for the first year after that, you can be placed on double blood thinners, aspirin and Plavix. There's also something called Celostal, which is used more for peripheral blood flow. So those are 3 of the common ones.
Right.
But bear in mind
that there are
you need to be
indications for those blood thinners as well.
And you need to really be assessed properly. I'm looking at this.
The next question.
I'm just saying hi. Okay.
Hi. Hi to you too.
Right. The other. Good night, sir. If your sugar is high, can it cause your ankles to swell? So it is not one of the common.
Retention?
Well, okay. So swelling of the ankle is a very common symptom that we see. It's very, very common, and it could be due to fluid retention. It could be due to lymphedema. Because lymph is, you have normal fluid retention, but then you have lymph which flows through the body. Now, swelling of the ankle could just be due to the veins. You have venous insufficiency. So just remember, you have 2 plumbing systems to the leg. You have the arteries carrying oxygenated blood, and you have the veins draining the blood.
Right.
And most times, swelling around the ankles as you get older is due to venous insufficiency. The valves in the vein is not opening and closing, and you can do a venous Doppler, an ultrasound to show that.
Right.
So I would say a high blood sugar is not directly related to swelling of the ankles unless you have heart failure.
You know that clip we looked at in the beginning, we were talking about macrovascular, and they focused on the heart, the brain, and then feet.
Yes.
So maybe that's why that question came up.
Right.
The feet swelling as a result of
poor blood supply. But I just want to be clear about this. Blockage of the blood flow to the feet doesn't often cause swelling. It might cause pain in the calves.
Okay.
So it's something called intermittent claudication, where you walk a short distance, or you walk up the steps or up a hill, and you get a cramping sensation, very typical, cramping sensation in the calves, and you rest, the pain goes away. If you have problems with the veins draining the blood, that's when you may have more swelling of the ankles. And of course, the other reason for swelling of the ankles is kidney problems, liver problems, and heart problems.
And those could all be connected with diabetes?
They could be, especially heart, yes. Heart and kidneys can be linked, yes.
Okay. All right, so we've looked at the known risk factors, we've looked at the risk calculator.
Yes.
What else do we need to move on to? Prevention?
Right. So, well, one of the slides I wanted to show, sorry, I'm getting distracted. It's the first time we're using the WhatsApp things here.
There's another question?
No, I'm just seeing some WhatsApp messages from previously. Okay. So I'm just trying to make sure I don't miss. But you can keep WhatsApping your questions, and we're going to open the phone line up probably in 2 or 3 minutes.
Yes.
And the number for that is
652-4855 if you're phoning in, and 360-0105 if you're WhatsApping.
So I'm trying to multitask here. You know, men are not very good at multitasking. You know, women are better, right? Right, Linda?
Well, I'm not too sure about that.
Okay. So I wanted to show slide 9. Slide 9. And this again is a little bit complex here, but compared to people without diabetes, people with type 2 diabetes, type 2, have the same risk of heart attack as those who have already had a heart attack. Now, I'll explain why that is important. And they have a 2 to 3 higher risk of heart failure, and sudden death occurs more commonly in people with diabetes than among peers without diabetes of the same age. So,
now that was a lot to take in.
Right. So that's a lot to take in. I'm seeing some more questions coming up. I'll try and answer the WhatsApp questions. But what they're saying then is that if you have someone with diabetes and compared to someone who has already had a heart attack, because once you have had a heart attack, you have a higher risk of having subsequent heart attacks. It's the same as a stroke.
Okay.
So somebody coming in with a heart attack 2 years ago, I would be much more aggressive in treating all their risk factors. If someone has never had a heart attack and have no diabetes or other risk factors, then I'll be less aggressive. But what they're saying, someone with diabetes, you have to treat them almost as if they have already had one heart attack.
Okay, let me just stop you there just a minute because we have a live phone in.
Good
yes, good evening. Can we have your question, please?
Dr. Khan and Ms. Khan. Right, I am 52 years of age. I'm of African descent. My legs tend to get heavy every so often, and I have been feeling every so often some burning in my toes.
And you have diabetes?
I just want to know what it may lead to.
Are you diabetic?
I don't think so.
So you have heaviness in the legs and burning in the feet?
Yes, but not very often.
Okay. So just today I had someone at one of my offices with similar symptoms, not diabetic, but heaviness in the feet and burning in the feet. So, you know, when somebody comes in with diabetes, because most of my patients, 99% of my patients are diabetics, my first question is, are you diabetic? Now, one thing I would say to the caller is that, have you been tested for diabetes? Because when I did that person's blood sugar, actually, it was slightly elevated, but I try not to make a diagnosis of diabetes on the basis of a finger prick test unless it's extremely high. So burning in the feet could be due to vitamin B12 deficiency. It could be due to hypothyroidism. I'm sure you're not a heavy alcohol drinker, so it could be to excessive alcohol intake. There are other causes of burning in the feet. Even people with the same venous insufficiency, problems with, because this patient had a venous ulcer, and so it was painful, but they also had pain and burning in the feet. So what I would say is that I think you need to have some blood tests done. You need to see your healthcare professional. You need to have some basic blood tests done. You should have a blood profile, blood sugar profile. Your blood count should be done. Your vitamin B12 levels and thyroid levels, etc. But you know, you could just try some simple medication, a vitamin B12 supplement, I sometimes use something called alpha-lipoic acid to try and help.
We have another live call-in
okay.
question. So, yes, good evening. Can we have your question, please?
Yeah, I was diabetic, right? My syndrome. Yeah. I think that doing any good.
So, do you want? Okay. Well, you know, the problem with the CDAP drugs is that it's very often generic drugs. Now, I'm not saying all generics are bad, but, you know, if some people have a very resistant lipid profile and it's familial, people of Indo-Caribbean descent, particularly if you're carrying a lot of fat around the tummy, your triglycerides are often high, your HDL is often low, and that's something I hope we'll have time because I have lots of WhatsApp questions here.
That, yeah.
But I would suggest if you're taking the Simlo and it's not going down, then it's well worth the investment. There's a similar Simlo called Simvadenk, which is a German brand. It's not too expensive, but then you go into the more expensive brand names like Crestor, Lipitor, Vytorin, and those are about $9 or $10 a tablet, so it's a little bit expensive. But you know, if the Simlo and CDAP is not working, then you need to go to one of the brand names. I have a question here. Good night, Dr. Khan. If a person is insulin resistant, why would a doctor treat the patient to produce more insulin with metformin or other drugs? So we're going a little bit off the topic tonight. I think Josh has put me in problems here tonight to be able to answer all these questions, but it's good that we're having so many people looking.
Yes.
Thanks for joining us. Right, so if your type 2 diabetes is a mixture of insulin resistance and insulin deficiency, and by the time you diagnose diabetes, the beta cells are beginning to fail. And with failure of the beta cells, you need to stimulate the beta cells, and metformin actually, so metformin does not stimulate the beta cells. Metformin is acting solely on the liver and against insulin resistance. So very often we combine a drug like Januvia, Diamicron with metformin, a drug that's stimulating the pancreas with metformin, and now we have newer classes of drugs that help insulin resistance.
Yeah. Okay.
So very often you have to combine the two because the beta cells are already failing. That's why we want to pick up people with pre-diabetes.
Yes.
Boy, there's so much to talk about tonight.
I think we're going to another break, actually.
Yes.
So when we come back, we'll try and look at preventions. I don't know if we'll have enough time with all the questions that you're getting, but Your Health, Your Choice continues in a few minutes. Don't go away. Come back. We'll be looking at macrovascular disease and diabetes.
Yes.
You're watching ACTN, The Voice. Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice. ACTN The Voice, your family-friendly station.
Your Saturday mornings just got a whole lot better on ACTN The Voice. Every Saturday from 7:30 a.m., tune into the classic kids programming, starting with Rocky and Bullwinkle at 7:30 a.m., Chip and Dale at 8 a.m., The Muppet Show at 8:30 a.m., Fraggle Rock at 9 a.m., Flintstones at 9:30 a.m. and Top Cat at 10 a.m. Kids Classic TV, only on ACTN The Voice.
For better or worse, yeah. For better or worse, yeah. Yo, Trinidad and Tobago, this is your boy Nathaniel, and you are watching ACTN The Voice.
ACTN The Voice, your family-friendly station.
Welcome back to Your Health, Your Choice. I know you were saying that if we don't get through all the questions this evening...
I definitely don't think we were going to be able to answer. Yeah. So what I'm going to try and do after the show is finished, I'm going to try and reply to some of the WhatsApp questions. But I'm going to give you another telephone number, maybe tomorrow morning. You can ring on, you can WhatsApp on 482-4269, 482-4269. That's our personal assistance number, and she would normally forward it to me, and I will try and answer the question. So if I don't answer your question on WhatsApp directly tonight, then I'll try and do that. But just another one quickly. Yeah. Dr. Khan, good night. I'm 59. I went for a blood test today and saw my blood was very thin. Is that normal? Can I say a lot of patients say that? It's very hard to assess the thinness of your blood by just taking a blood sample. And actually, when you see thin blood, that's probably a good thing because it means that the blood is flowing nicely through the arteries. It's worse when the blood is very thick. So I would not worry about that.
Okay, good. Right, so did you know that every 10 seconds, 2 people develop diabetes globally? And we've been looking at the 8 risk factors, and I think we want to look at how we combat the risk factors. But now we have another live call, so we'll take that first. Hello, can we have your question, please?
Since 1985, and now it's affecting all my body with pain. Osteoporosis, I have cripple, I can't move my hand, I can't do nothing for myself. What can I do about it?
Okay, so, this is where the multidisciplinary approach to diabetes comes in, and as we move forward with the Diabetes Wellness Center, we will have a podiatrist, we will have a fitness instructor with us, we would have a diabetes educator. Even in some centers, you have somebody who's a pain specialist, involved with pain control. I would be very careful to say that diabetes is responsible for all your pain because there are things like fibromyalgia, arthritis, osteoarthritis, rheumatoid arthritis. So is the pain all due to diabetes? I'm not sure, but in a nutshell, I think you need to see maybe a physiotherapist or an osteopath, but there are tablets we can offer you, things like Lyrica, Cymbalta, Tegretol, with normal painkillers to make your life as comfortable as possible. So that's a difficult question to answer, but that's with a multidisciplinary team. And there was another question here, how can I make an appointment with the doctor? Well, the number we give is 482-4269, and depending on where you are in the country, we have a few sites where we are based. So we wanted
to look at, I think it was slide 11.
Yes.
Controlling risk factors.
Risk factors. And this comes back to the risk factors that we were talking about before. So research shows that the benefits of reducing the modifiable risk factors for atherosclerosis. So that term modifiable is very important because you see family history is not there. Family history can't modify your genetics, at least not yet. But dyslipidemia, I'll explain what that is. Smoking and exposure to tobacco smoke, high blood pressure, diabetes, central obesity, and physical inactivity. So that's going to take us up the rest of the program.
So dyslipidemia first, because that's the longest word.
Right,
there.
so dyslipidemia. So how do you know if you have an abnormal lipid profile? Well, you need to go to a lab fast. Well, actually, the latest guidelines, and this may surprise some people, is you don't even have to fast now for a lipid profile. Now, some of the labs will still say that, but the latest guidelines from the American Heart Association says you don't have to fast. Why do I say do a proper lipid profile? Because you just don't want to know your total cholesterol. You want to know your LDL, bad cholesterol, HDL, good cholesterol, VLDL, bad cholesterol, and triglycerides.
Okay, we have a live call again.
Yep.
Good evening. Can we have your question, please?
Hi, good afternoon. I've been diagnosed with tricuspid and bicuspid regurgitation since 2011 or 12, and like for the past 2 months, I've been constantly getting a lot of pain more in the chest area. Do you think it's related to the heart?
Okay, how old are you?
28.
28, okay. So tricuspid and regurgitation, so that has to do with the valves in the heart. Now, I'm going to be cautious here. I would say it is probably unlikely, but because remember the chest wall is made up of the heart, but you have the lungs, you have the ribs, you have the muscles, and it's incredible how many people come in with chest pains and it's not due to the heart. Yeah. Even diabetics, it's muscular. Of course, women with breast tissue, especially at certain times in the month, you can have fibroadenosis, you can have very tender breasts. So my advice to you at 28 is probably unlikely. But you should really see a cardiologist and have an echocardiogram to see what's the update if you have not seen a cardiologist yet.
Okay, we've got 10 more minutes left, so we were looking at controlling the risk factors.
Yes.
I know you're still looking at WhatsApp messages and...
Right, okay, so controlling the risk factors, if we did your diabetic, you have a high LDL, low HDL, high triglycerides. So not just the total cholesterol. Your triglycerides are high, your HDL is low, your LDL is high. What it's telling us is that the LDL particles are very toxic. And then if we do your CVD risk calculator, then you should go on a cholesterol tablet. If your CVD risk is above 7.5% for the next 10 years, so let me just say that quickly, above 7.5%, and that's where we do the CVD risk calculator. So it's not guesswork. I'm not just saying you need to do this. So I'm doing a calculation, and if your risk is above 10%, then you should be on aspirin.
Okay. Now there's something called lipid targets, but we'll talk about that because we now have another live call. Yes. Good evening. Can we have your question, please? We can't hear.
The call is not very clear. Sorry.
Can you repeat your question, please?
Hello?
Yes?
Yes, that's better.
Is it that hereditary or is it because of your diet?
You came through clearly and then it went softly again. I'm sorry. Can you WhatsApp the question on...
Hello?
Yes?
Yes. Yeah, we can hear you now.
Yes, we can hear you.
Good night.
Good night. Good night.
Good night. Is it that heart attacks are hereditary or is it because of your diet?
Right. Heart attacks, is it hereditary or due to that? Well, it can be a combination. Now, can I just, and that's a brilliant question, because I think we underplay the role of genetics in diseases on the whole. I mean, cancer risk, in heart disease, diabetes, especially diabetes. So heart disease, you can have a family history that triggers from a young age your risk for heart disease, but then certainly poor lifestyle, sedentary lifestyle, lack of exercise, and dietary can exacerbate it.
Okay. Right, so are we going to continue with the controlling?
Well, the controlling,
factors,
so if you're a smoker, you need to stop smoking.
Yeah.
You know, when we do the cardiovascular risk analysis on that profile, when you put in smoker as opposed to non-smoker, and sometimes I do this for patients, it's amazing how your risk escalates if you're a smoker. High blood pressure, notably difficult to measure blood pressure in the doctor's office. One cardiologist says that, in fact, I had him on the program, he calls it anticipatory hypertension, just the anticipation. He does 3 blood pressure readings when the patient comes in, right hand, left hand, and then maybe...
Standing and sitting.
Yes. So high blood pressure, if your blood pressure is consistently above 140/80, then you might need to be on blood pressure tablets. Of course, we talked about diabetes, central obesity, so a lot of fat around the tummy area. And I know a lot of people are setting up weight loss clinics, and a lot of people are talking about using drugs for weight loss. I would try to get people to use natural means, but even some new diabetic drugs are now, and let me just say this also, we're talking about macrovascular disease. For the first time, we have 2 groups of drugs that are now able to give you heart protection with diabetes. There are drugs like Jardiance, Forxiga, Invokana, those are the SGLT2 inhibitors, and the GLP-1 agonists, and we're waiting. Some of you may see drugs like Trulicity, advertised, Victoza, they're giving you heart protection as well.
Okay. Right, so healthy lifestyle changes are essential. We talked about diet, we talked about nutrition, fitness, foot care, weight loss. All of these things are going to be working in tandem with each other.
In tandem with each other.
To make it preventable and manageable.
Right. So, as we come to an end, because I think we only have a few more minutes, the question is, who should we be sending for cardiovascular investigations? Now, there's a little bit of controversy over this, because some people will say, well, if you're diabetic, all diabetics should go and do an ECG or a stress test. Can I just say, just a resting ECG, so you go to your doctor's office and you have an ECG, you lie in a bed and you have an ECG done. Now, that may show you some abnormalities with your cardiac rhythm, but sometimes, a lot of times, it will not show you coronary artery disease. And just over the last week, I've had 2 or 3 patients I sent for stress testing. That's where you go on a treadmill and you do an exercise stress test, and the report has come back to me suggestive of ischemic heart disease or positive stress test, and now that patient has to be sent to a cardiologist to think about doing an angiogram.
Okay. Right, so we're winding up now. We've got about 3 minutes left.
3 minutes left.
And we've been looking at macrovascular disease, how it affects the heart, the brain, and the feet. I think we didn't spend too much time on that. But thank you so much for all your WhatsApp questions and your live call-ins. Dr. Khan will be answering as many of the WhatsApps as he can this evening, and if not, tomorrow morning as well.
Can I just say, I mean, it's the first time we're using the WhatsApp medium, and it has worked very well, and several of you have sent the question, so if I will try and respond, but can I just say again, maybe if you're not getting a response, you can ring back on that number, which is the number for appointments as well as the number for queries, 482-4269, 482-4269. And, just to remind people that the whole aspect of diabetes wellness is something that we are pursuing very aggressively and putting a whole team together. And I just want to mention your ESB course that you have pioneered. I want to congratulate you, all your students. I think...
well, it's not just me. There's Mrs. Jardim in Port of Spain.
Right. It's the English-speaking board.
With the English-speaking board, and we got all distinctions this year. So
and that's part of our outreach as well, teaching people to do public presentations.
Yes. Don't forget our XOXO conference.
Marriage conference.
On the 16th of February.
At number 12 Johnson Street in Coquet. The Anaposis Chapel is visible on the bypass. At nights you can see a big lighted cross, and you can ring in on 482-4269.
Okay, anything else you want to say? We have 1 minute left.
1 minute left. Well, I just want to say that I've been preaching a series of messages talking about simplifying our lives, and it's instructive for me, first of all, because I can very often be driven to fill my schedule up. And on Sunday morning, we were talking about moving from anxiety to a peaceful shalom type of life. And one of the things I want to encourage you to do is to be wise with the people that you surround yourself with. There are people who can be friends for a while in your life and they move on, and then there are people who are true friends, friends for life, who can nurture you, who can have your back, but who can also I wouldn't use the word critical, but I'll give you good advice that there might be areas of your life you need to change. So the word shalom is the word I want to leave you with as we come into February 2019. It's talking about wholeness, it's talking about health, it's talking about peace, and it's talking about living a life of integrity and transparency. So I want to wish you shalom tonight, and thank you for watching.
Okay, Your Health, Your Choice returns in a fortnight's time. We will be replaying, it won't be live, on Thursday at 1 p.m. and Sunday at 6:30 p.m. over the next fortnight. So thank you for joining us, and we'll see you in a fortnight's time.